Hey everyone, Crystal here, your friendly finance-obsessed friend. Today we'll dive into why being uninsured in America is a gamble and the vital importance of emergency savings. But first, our handy assistant has a quick disclaimer.
All of the MillennialFI content is intended for educational, informational, and entertainment purposes only and is not to be taken as legal, financial, investment, or tax advice of any kind. Please consult a licensed financial advisor, certified financial planner, certified public accountant, or tax attorney before undertaking any investment or tax strategies for your specific situation. You are responsible for all of your decisions.
Man, last week was a roller coaster, hence the delayed episode. Moving into the third trimester of pregnancy, I faced unexpected health issues, leading to a visit to urgent care and eventually the ER. Luckily, my dual insurance covered it, but without the addition of public insurance, it would have cost me $3,100 out of pocket. After a chaotic night, we ended up yet again at urgent care the next morning. This time not for me, but for my husband, who was promptly transferred to the hospital for emergency surgery. Our emergency savings will help cushion the hit, but we anticipate a total expense out of pocket of about $3,100 for his surgery and should see the bills rolling in if not completed by March of next year. An update will come in a later episode. For now, his issue is resolved and he's doing well. Mine is still ongoing but slightly more sporadic and likely to resolve completely during postpartum. See, that's the thing though. Earlier this year, he took a gamble of being uninsured in America. If his appendicitis had presented during the time he was uninsured, he not only would have possibly risked his life, but everything we'd worked so hard for the last few years. While Medicaid share of cost would have helped, we still would have been subject to a substantial out-of-pocket thanks to how resources are measured for that program. Uninsured, without utilizing share of costs, these incidences would have easily exceeded $50,000. And we don't have that kind of money laying around, but we do have oh shit funds in an easily accessible high-yield savings account, which is equal to about 6 months of expenses plus out-of-pocket costs. Can you afford your share of a medical emergency? Are you uninsured? Are you underinsured? These are things that are important not only for you and your family, but for your financial well-being. Because when it comes down to paying the bills and being able to afford healthcare, a lot of Americans end up having to put it off. And because of that reason, that's how my dad ended up in the ER, basically dying from sepsis, and then had to have multiple heart surgeries and spend 3 months in intensive care and racked up $3 million in healthcare costs over the course of like one summer, because in America, we don't seek help when we need it because we can't afford it. Times are changing though, and there's steps we can take to stop that cycle. However, in a country with low financial literacy and subpar health insurance options, most Americans lack emergency savings, and those who do have less than $10,000 set aside. With healthcare emergencies often surpassing this amount, it's crucial to weigh short-term savings from a high-deductible plan against long-term costs. Low-deductible and out-of-pocket plans aren't always an option. For example, the employer we worked for in university only provided a high-cost plan, which is how we ended up paying medical debt over tuition. It's so important to know your numbers and your appetite for risk, especially if you're living in the United States. This is why we've prioritized building enough emergency savings to weather unemployment and healthcare storms, even if it means sacrificing in the short term. Tell me, how does your health plan stack up?